All right, today we're going to tackle a huge topic, the state of our mental health. We're going to start with the big global picture and then zoom all the way down to the personal, the tools and lifelines that are out there for every single one of us. So yeah, let's get right into it. So let's start with this number, 63%. According to the latest Global Burden of Disease study, that's the increase in death and disability from anxiety disorders. It's a staggering figure, right? And it really sets the stage for why this conversation is not just important, it is absolutely urgent. Okay, so we know the challenges are getting bigger. The big question for all of us is, what can we actually do about it? Well, that's what we're here to explore. We're going to journey from understanding the scale of the problem to uncovering a whole toolkit of real, evidence-based solutions. First up, let's get that 30,000-foot view. Zoom out of it. We're going to look at the global state of mental health to really get a handle on the larger trends that are shaping our world right now. So the data shows this major shift in global health. We've gone from primarily fighting infectious diseases to now confronting what are called non-communicable diseases or NCDs. And while things like heart disease and diabetes are right at the top, the burden of mental disorders is surging right there alongside them. But what's really alarming, truly, is the rise in death rates among young people in some areas, often driven by suicide and substance use. Okay, so now let's bring it down from that global level, right down to the personal. How can we actually spot the warning signs of mental health struggles, whether it's in ourselves or in the people we love? Because, and this is so important, recognizing them early is absolutely key.
It's really crucial to know the difference between early signs and crisis signs. Early signs can be subtle. Maybe you notice someone pulling away from their friends, or they just don't seem interested in their hobbies anymore. But crisis signs, well, they're much more urgent. Things like neglecting personal hygiene, or, of course, any talk of self-harm. The main takeaway here is this. If we can notice and act on those early signs, we can often prevent a crisis from ever happening.
All right, we've looked at the problem, let's talk solutions, because this is where the story gets really hopeful. There's this whole expanding array of treatments out there, and I want you to think of it not as some confusing menu, but as a practical, modern toolkit for your own well-being. So, talk therapy. It's really a cornerstone of this wellness toolkit. Let's just quickly break down 3 super powerful approaches. You've got CBT, which is kind of the gold standard for anxiety and depression. It helps you reframe negative thought patterns. Then there's DBT, which is all about regulating intense emotions, and it's really effective for things like borderline personality disorder. And finally, MBCT, which cleverly uses mindfulness to help prevent depression from coming back. Now here is a fascinating new tool in the kit, Digital Therapeutics, or DTX. And listen, this is not just another wellness app you download. No, we're talking about clinically validated prescription-based software that can actually treat or manage a condition. And get this, sometimes with outcomes that are just as good as traditional therapy. It's a whole new frontier for accessible care for sure. But, and this is a big but, access to these amazing new tools is really uneven. You see high-income countries integrating DTX right into their healthcare systems, but in low- and middle-income countries, it's mostly stuck in these small pilot programs. This really shines a light on a huge challenge we have ahead of us, making sure everyone gets access to these innovations. And the toolkit doesn't stop there. It also includes some incredibly powerful lifestyle changes that are backed by hard data. I mean, look at this. Regular exercise can cut depressive symptoms by up to 40%. Mindfulness can lower stress by 30%. Even what you eat matters. A Mediterranean-style diet is linked to a 33% lower risk of depression. And please, never underestimate sleep. Getting enough is literally one of the most protective things you can do for your mental health.
Okay, let's shift gears and talk about the place where so many of us spend a huge chunk of our time, the workplace. Supporting mental health at work isn't just a nice-to-have HR thing anymore. It's become a core business imperative.
These numbers, wow, they show a massive disconnect, don't they? You have nearly all top employers saying they have a mental health strategy, but at the same time, over half of their employees have thought about quitting because of it. So what's going on? Well, the gap is often between offering surface-level perks and actually addressing the root causes, like the fact that 71% of people are working outside their scheduled hours. It's a clear mismatch between good intentions and real-world impact. So to try and bridge that gap, this new concept is starting to pop up, well-being intelligence. And the idea is pretty simple, really. It means that modern leaders have to be skilled at navigating the human side of work, fostering psychological safety and creating an environment where people can actually thrive, especially as we bring in new tech like AI. And speaking of AI, here's something that might surprise you. Check out this consensus. A massive 94% of HR leaders are interested in AI-powered mental health benefits. And get this, nearly 90% of employees say they'd be comfortable using them. This points to a huge opportunity to scale up support in a way that pretty much everyone seems ready to embrace.
So we've covered the global landscape, the warning signs, the modern toolkit. Now we get to the most important part of all. How do you take that very first step? How do you find your own lifeline?
Asking for help can feel overwhelming, I know, but we can break it down into simple, manageable steps. Just start by talking to a professional you trust. That's it. From there, be an active partner in your own care. Bring in those powerful self-care strategies we talked about, like good sleep and exercise. And finally, just stay engaged. Consistency really is the key to recovery.
Please just take a moment and look at these numbers. If you or someone you know in the US is in an immediate crisis, you can call or text 988. It's free, it's confidential, it's available 24/7. For help that isn't urgent, the NAMI helpline is a fantastic resource. And for anyone in Australia facing an urgent situation, the number is 000. Just knowing who to call is a vital part of any wellness plan. So, we've explored the entire landscape of mental health, from these huge global challenges all the way to a powerful toolkit of solutions. And really, the only question left is a personal one for you. Seeing all these tools that are available, from therapy to tech to simple lifestyle changes, how will you start building yours?